Hello, this is Jeff Bellinger here for another 2 Minute on Tuesday. Wanted to bring you up to date on some of the changes that are popping up for the healthcare reform. The healthcare reform, you're going to see that the Senate is trying to take away the tax-free status for health insurance, not only for employers but employees. Whoever pays a portion of the premium, it would no longer be considered tax-free. The vast majority of people still do get their insurance through their employer. About 177 million people is the count that they have that get insurance through their employer. Let's look at how this works really quick so we can have an understanding why they're looking at this. One of the inequalities that they say of the system is that it benefits people that are earning a higher income. So if you look at somebody who's earning about $1,000, or for every $1,000 an employee earns that's in the 15% tax bracket, they're paying about $281 in taxes. So the $281 is a savings to that employee or employer when they're providing that in the form of health insurance. Look at somebody who's not getting that through their health insurance, that's costing them $281 more because they're having to earn far more than the $1,000 if they had to buy $1,000 to provide that coverage. Flip a little bit higher in salary, somebody's in a 25% tax bracket, they're saving about $374. So the savings actually goes up as the income goes up, and it directly benefits people that are getting their insurance through their employer. So that's why some of this is being looked at here, is to kind of level the playing field so that regardless of whether you're at an employer or you're buying your insurance coverage directly, that there's not a difference in the cost to individuals. The other reason the Senate's really looking at it, well, first, when the House looked at it, when the House put the first bill together that was passed recently, they considered the same option, and it was immediately pulled out when they got a lot of feedback on it. The Senate is considering it a lot more heavily because there's a provision, or there's a rule in the Senate that in order for a bill to pass by simple majority, which is just 51 votes, you need to be able to create $119 billion savings over a decade. Well, healthcare reform right now is the largest tax kind of expense that's being avoided in the federal government. It's about $260 billion a year. So for the Senate, it seems like it's a real easy pickings to go after this tax because they could create the savings needed to make their bill a simple majority pass in the Senate. So you're going to see a lot about this over the next couple weeks because the Senate is aggressively trying to put together a bill. One estimate is they want to get one done by June. They certainly want to get one done before the end of summer, before they adjourn for the summer. So you're going to see a lot about this. Make sure you reach out to your senators and let them know how you feel about this. If you got any questions about the current law, we'll keep you up to date. Otherwise, reach out to me. My name and number will be on the next screen. Thanks for watching.